Here now to discuss the joys and challenges of parenting later in life are clinical psychologist and parenting expert Dr. Laura Markham, journalist and entrepreneur extraordinaire Joan London, and program director of the NYU Fertility Center, Dr. Jamie Grifo. Hello, you guys. You know, Joan, you had children in your 30s.
Yes.
Then you had two sets of twins by surrogacy in your 50s. May I say that?
Well, we started trying when we were when I was about 45, 46 years old, and had about 4 rounds of in vitro.
Yeah.
And then we turned to surrogacy.
I was talking about your age. Do you mind?
Yeah, and
you don't mind saying that.
No, I don't. I had round 2 in my 50s.
Yeah.
And I'll tell you something. I went through a huge transformation and decided to take charge of my health when I was about 39 years old.
Yeah.
I'll bet you I'm healthier today. I'll bet you I added years to my life, but I really am more fit.
Well, you lost weight. I remember
yeah,
you lost a lot of weight.
I lost a lot of weight,
yeah.
but also just took charge of my health. And I was, I saw someone the other day, a woman who was in a store, and she was probably, I don't know, 32, 33, maybe she was 35, but she was struggling just to even be able to take this child out of the stroller. And I thought, you know what? I probably have a longer life expectancy than she does.
Right, well, maybe.
So it doesn't really, guarantee anything because you have your children in your 20s or your 30s.
Right. Are you planning anything for your 70s?
No. I'm done. Done.
Okay, let me talk to you, Dr. Laura. I was reading that you said a person should not have a baby before the age of 28. It so happens I was 28 when I got pregnant.
How'd that work out for you?
It was great. It was great. It worked.
You know,
I was a little more mature then, I think, than I was when I was 21, that's for sure.
people are really still children until they're 28. And the
Why
thinking in the field
28
of,
though?
well, the thinking in the field of psychology is that adolescence lasts a little longer. And in the old days, people settled down and got married and started having babies when they were in their 20s. Nowadays, people put that off, and the 30s are the nest building stage.
Right.
And actually, parents are much better equipped to be good parents at that point. They're more patient.
In their
They're more
30s.
mature. Hopefully they've done some building of their careers and professions so that they can spend a little more time with their child. But I should add that what really matters when you raise a child is the relationship you build with that child.
Right.
That's really the only thing that matters. Everything draws
The
from that.
problem, though, doctor, you can address this, is that when you reach 39, 40, 42, you have like only a couple of eggs left, right?
Well, when
then it
you're-
becomes a problem. And just when you're matured enough to have a baby, nature turns on you.
Right. Sociology and biology have diverged. I
Yeah.
mean, we're much more capable to be parents at an age when we're much less capable of getting pregnant, and that's the problem. You know, at age 30, you only have 88% of your, you've lost 88% of your eggs. When
Yeah.
you reach age 40, you lost 97% of your eggs. So, and that's a female thing. Men keep making new sperm every 90 days, so their fertility doesn't change much. But women, there's a dramatic change, and that's the problem. And that's where women have to be really smart about the decisions they make regarding their fertility, because the best thing is to avoid being an infertility patient. It's not a great process to go through.
Yeah.
And the longer you wait, the more you risk the possibility that you'll end up in an office like mine and have to be treated. And
Yeah, but
and
there are many advantages, as you know, Joan, as Joan was just saying, to having them later and being
So does
mature.
Jimmy Griffo. You have,
well,
you have
I'm-
little babies.
I'll be 55 this year. I have a two and a half year old and a 6-month-old.
Really?
So
when you're 80, your kids will be how old? 25, 4, 3?
in that range. But
You know
so-
something,
That's the
Joy?
part. That's the
But you
part
know
that we need
something,
to talk
Joy,
about
but
here.
What's
wait a
80 like
second.
today?
80
80 is a little different than it used
I
to
mean,
be,
my
right?
mom's 91 and going strong, but men have been getting divorced and remarrying
I
and
know.
having children in their
Well,
50s
we-
for
we-
decades.
I
We also
know.
have a cultural divide here. We don't get upset when a 70-year-old guy has a baby. The minute a 47-year-old woman has a baby, everyone's like,
That's
we're
right.
on TV talking about it. Why is that?
Well, I mean, you know, there were actuary tables. Let's talk turkey here. If you're gonna have a 20-year-old when you're 80, you probably won't be living that much longer. So the child at 20, a kid really still, has to deal with the death of a parent at a young age. It's not easy. That's an issue to deal with, isn't it, Joan?
But life expectancy, we were talking about in the green room, you know, for me, at my age, being fit is probably
You're probably 100.
100,
based on
105.
your current
Based
health
on what's
and-
happening
What
today.
about
What are you
your
saying?
health?
What do you mean? You're
Because-
100?
Good, I got
105.
7
No,
of
her-
them to
her
take
life
care of me.
You know, these are hard decisions that you make about aging parents. I think we've all had to make decisions about our own parents that were tough. And so when you're asking a child who's 25 to make these decisions, that's a lot to ask. So if you're still going strong at 90, great.
But there's another issue, Joy, and that is just the fact that life has changed in this world, and particularly in this country. While life expectancy is longer, you really have to look at the first part of life. Whereas, you know, for fertility, I know the 20s would be great. However, women don't go to college to find a husband anymore. They go to college to be educated, to start a career. Everything has shifted back 10 years. You know, the number of women getting pregnant at age 35 is what? Quadrupled
really
in the last couple of
Whereas
decades?
they would have years ago gotten pregnant at 25.
Yeah. So we're
Right.
not. We have to discuss reality here. It's not. These aren't just decisions.
But let's face it, Joan, women lose either way. If you don't do it when you're fertile, you have to do in vitro. And if you do it when you're fertile, your career suffers. Everybody, women always have to come up against these problems, as you were saying before.
It's true.
It's
really
true.
is true.
All right. So here's an issue that I asked before. What about freezing eggs? Because for years and years we've been able to make embryos and freeze sperm.
Yeah,
but
what
what about
about that?
freezing eggs?
Well, it's definitely an option. I think women need to be really thoughtful about their fertility. And I think, you know, part of sex education, they should be talking about fertility and what happens with age so that women get a good education so they make good decisions along their life. Because a lot of people end up in my office at 44, oh, I tried 2 months, why aren't I pregnant? And they have no clue that their chance of getting pregnant is incredibly low, and no one counseled them. You know, now I think it's out and people understand it. So there are options about how you decide to live your life. And yes, if you're young and on a career track and you know you're going to delay your childbearing, you know, you can freeze your eggs and have a much better chance with your 30-year-old eggs when you're 40 than your 40-year-old eggs when you're 40.
This whole thing, though, with in vitro is a little tricky. Look at this Octomom and Kate Gosselin and these girls who they have so many kids that they can't afford to raise. I mean, it's a tricky situation.
Well, I mean, those are outliers, and there are things you can do to avoid those situations that weren't done in either of those cases. That's not the norm, and it rarely happens. And those two cases are two examples of medicine gone awry and could have been managed better with a different outcome.
But they didn't have to have all those babies, right?
No, they didn't.
Right.
And but
Then there's the moral issue of which ones to get rid of, or there is
well,
that issue.
but you don't even put them in that position. Just put back fewer embryos. You don't
Right.
worry about that, or don't use drugs that are patients hyperstimulated. Has too many eggs. Don't let them get pregnant that cycle. Cancel it. Avoid it.
Okay, thanks everyone. Very interesting discussion. And check out Joan London's new bedding line, Joan London Home, launched on QVC. We'll be back in a minute.